Good day, Dean. My name is Diana Ingles from BSN4, and today I'm going to answer some self-directed learning activity on psychiatric nursing. So the first question would be, what is schizophrenia? What are the types of schizophrenia? What are the signs and symptoms of schizophrenia? Treatment and nursing intervention. So now let us define first what is schizophrenia. Schizophrenia is a mental health condition that affects someone's thoughts, emotions, and behavior, and ability to communicate, plan, and relate to others. Schizophrenia typically starts in late adolescence or early adulthood and can vary in severity. Its exact cause is not fully understood, but is believed to involve in a combination of genetics, environmental, and brain chemistry factors. In 1911, Eugene Breuer, a Swiss psychiatrist, coined the term schizophrenia. Schizophrenia affects people in different ways, but there are some common symptoms, and these are the symptoms of schizophrenia: confused speech that is intact but hard for others to interpret and understand, a lack of facial expression, a lack of emotional expression, a lack of motivation, difficulty concentration, delusions and hallucinations. And the previous, or the DSM-4, described the following 5 types of schizophrenia. So there are 5 types of schizophrenia, which is the paranoid type, the disorganized type, the catatonic type, the undifferentiated type, and the residual type. So first, let us discuss what is the disorganized schizophrenia. So disorganized schizophrenia is defined as the involvement of severe cognitive, behavior, and emotional symptoms. People with disorganized schizophrenia typically experience disorganized thinking, which means that they may have racing or illogical thoughts or make connection between unrelated ideas. They also tend to express their thoughts and emotion in ways that others find confusing, bizarre, or unsettling, such as speaking in unusual patterns and laughing or scolding in inappropriate times. This type of schizophrenia is often considered the most serious type, as it typically affects daily functioning, or ADL of the person, for the greatest extent. Next would be the catatonic schizophrenia. Catatonic schizophrenia is considered as a rare, severe mental disorder. It is characterized by striking motor behavior, typically involving either significant reductions in voluntary movement or hyperactivities and agitation. In some cases, the patient may remain in a state of almost complete immobility, often assuming statue positions. A person may appear excited or withdrawn. They may also display other symptoms such as mutism, which is unable to speak, echolalia, or repeating other people's words, echopraxia, which means the mimicking other people's action, and depression, mania, and also psychosis. The third one would be the undifferentiated schizophrenia. So undifferentiated schizophrenia is a subtype of schizophrenia. Symptoms of undifferentiated schizophrenia may include psychosis, such as delusions, hallucinations, or drastic changes in behavior, speech, or immobility. So next would be the residual schizophrenia. So residual schizophrenia is a chronic form which includes illogical thinking, social withdrawal, negativistic symptoms, or not talkative at all, or does not say at all. This is the residual schizophrenia. So the signs and symptoms for that is that the patient may manifest hallucinations, delusions, aggressions, bizarre behavior, suspiciousness, excitement, grandiosity, nonsense word, shifting quickly from one thought to another, thought, moving slowly, unable to make decisions, writing excessively without meaning, forgetting or losing things, lack of emotion, social withdrawal, lack of motivation, lack of or loss of pleasure, poor hygiene. So the treatment for that, or the medications for schizophrenia and its type, includes the anxiety drugs, which for example, is the diazepam or the rolazepam. We have also the antipsychotics drug, which is the haloperidol, risperidone, and olanzapine. We have also the psychotherapy to help patient, like the behavior therapy, cognitive therapy, milieu therapy, meditation, and the individual psychotherapy. So for our nursing intervention, the first thing that we're going to do is to establish trust and a therapeutic relationship to a patient. Building rapport through consistent, clear communication and honesty provide a calm and supportive and non-judgmental environment to the patient so that we can easily communicate to the patient and we can build trust to the patient so that they can share what they have in mind and that we can help them. So next would be the monitor and assess symptoms, assess for positive, assess for symptoms like hallucinations, if the patient manifests hallucinations, delusions, anhedonia, social withdrawal, flat affect, and then monitor changes in behavior. We need to monitor or assess patient's behavior or deterioration of mental status. And then we need to provide medication as ordered by the physician on time. And then we had to next is we need to enhance the coping and problem skills of the patient, such as relaxation technique, distraction methods during periods of distress, and help patients develop problem-solving strategies for managing daily challenges. And then we need to promote psychoeducation and then assess reality orientation, create a structured environment, and then ensure safety of the patient. And then we need to encourage healthy lifestyle choices to the patient. So for question number 3, we need to describe the maladaptive patterns of behavior in terms of its definition, signs and symptoms, treatment, and nursing intervention. So there are 5 maladaptive patterns of behavior, which is the schizophreniform disorder, schizoaffective disorder, delusional disorder, brief psychotic disorder, and shared psychotic disorder. So the first thing that we're going to discuss, or the disorder that we're going to discuss, is the schizophreniform disorder. Schizophreniform disorder is defined as a psychotic disorder with symptoms identical to schizophrenia, but it only lasts for 1 to 6 months. The duration, the difference between schizophrenia and schizophreniform is that the duration, it only lasts for 1 to 6 months, and the signs and symptoms for it is that the patient will manifest the following: hallucinations, delusions, disorganized speech, behavior, apathy, blunt affect, social withdrawal, impaired cognitive functioning, or poor decision making. For the treatment, the patient may take antipsychotic drugs. Example for that is Risperidone, olanzapine to reduce psychosis. And for the psychotherapy, the patient may undergo cognitive behavior therapy to address some coping strategies. For nursing intervention, the first thing that we're going to do is we're going to build trust and report the patient so that we can gain some information, or we can observe the patient thoroughly. Next is we're going to monitor for suicidal ideation and aggression, use clear and ambiguous communication to build trust, and encourage adherence to medication regimen. So we need, when we say we need to encourage adherence to we need to ensure that the patient is taking the medication by magulat sa patient when taking the medication, to ensure that the patient is complying or is taking really the medication. Second would be the psychoaffective disorder. So the psychoaffective disorder is a hybrid condition combining the schizophrenia symptoms with mood disturbances. So it's a combination of the schizophrenia symptoms and mood disturbances, or the mania or depression. The signs and symptoms for that is that the patient may manifest hallucinations, delusions, disorganized thoughts, hyperactivity, risky behavior, reduced sleep, fatigue, low esteem, and suicidal thoughts. The treatment for that is that the patient may take antipsychotic drugs and mood stabilizers and antidepressants, including lithium. And then we also need to have the electroconvulsive therapy, or the ECT, for severe cases patient. So the nursing intervention first is to build trust and rapport to patient, assess for mood swing and suicidal risk, promote social skills through group activities, and educate family on relapse signs. Like relapse signs include insomnia or agitation. So for delusional disorder, the third maladaptive pattern of behavior is a delusional disorder, which is defined as a fixed non-bizarre delusions. Example, persecution, jealousy, lasting less than 1 month without any other schizophrenia symptoms. So symptoms may include systemized logical delusions, believing in being spied on, like isundan-sundan sila, generally preserve daily functioning. So the treatment for that is that the patient may take antipsychotic drugs to reduce delusional intensity, and then we're going to include the cognitive behavioral therapy for the patient. And then for the nursing intervention, the first thing that we're going to do is we're going to avoid reinforcing delusion, redirect the reality-based topic. We're going to redirect if the patient may manifest some believing and being spied on. We're going to redirect to reality-based topics, and then we're going to assess for violence tendencies linked to persecutory delusions and monitor for comorbid depressions or substance abuse. Next would be the brief psychotic disorder. So brief psychotic disorder is described as a sudden stress-induced psychosis lasting 1 day to 1 month, often resolving fully. So the signs and symptoms include hallucinations, delusions, disorganized speech and behavior, precipitated by trauma. Example for that is accident. And then for the treatment, we have also the antipsychotic drugs, haloperidol for symptom control, and crisis counseling to address stress triggers. Nursing intervention includes ensure a low simulation environment to reduce agitation, provide psychoeducation on stress management technique, and monitor for progression for chronic disorder such as schizophrenia. Last would be the shared psychotic disorder. So sa shared psychotic disorder, is this a rare condition where delusion transfers from a dominant individual inducer to a subordinate person or the recipient. Signs and symptoms include recipient adopts inducer's delusion, paranoid beliefs, like mo transfers from inducer to recipients ang delusions nga na-feel sa patient. Symptoms resolve upon separation from the inducer. So treatment would be separation from the inducer. And then last would be the antipsychotic drugs and individual therapies for both parties, both the inducer and the recipient. Nursing intervention includes facilitates safe separation and independent reality testing, and strengthening the recipient's social and coping skills, assessing for underlying vulnerabilities or dependency traits. Fourth would be, we need to describe what is fetal alcohol syndrome in terms of its description, signs and symptoms, treatment, and nursing intervention. So what is fetal alcohol syndrome, or the FAS, or the FAS? Fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the pregnancy or the mother's pregnancy. It is most severe form of fetal alcohol spectrum syndrome resulting from prenatal alcohol exposure. It leads to a lifelong physical, cognitive, and behavioral impairments. What are the signs and symptoms for fetal alcohol syndrome? So the signs and symptoms include distinctive facial feature, like manifest or na symptoms ang child nga small eye siya, thin upper lip, smooth philtrum, small head size, vision, problems with vision and hearing, and heart, kidney, and bone issues. We have also, for the cognitive side, the patient may manifest learning disabilities, memory issues, intellectual disabilities, poor judgment, and hyperactivity, attention deficits, mood swings, social skills challenges, low body weight, short height, sleep and sucking difficulties. For the treatment, for early intervention or for early treatment, we need to have a special education, occupational therapy to address developmental delays of the patient. For medication, we need to stimulate for hyperactivities. We have also the antidepressants for mood issues, and also we need to have the family support or parental training to manage behavioral challenges. For the nursing intervention, our nursing intervention is, first we need to gather maternal alcohol consumption history to a diagnosis. We're going to interview the mother about alcohol consumption, and then minimize external stimuli to reduce agitation, and then teach stress management and structured routines. We need to emphasize the mother about the signs or the effect of consuming alcohol during pregnancy, so that the mother may understand the current situation of the child. So next is we're going to define what is ADHD, or the Attention Deficit Hyperactivity Disorder. ADHD is a neurodevelopmental disorder characterized by persistent inattention, hyperactivity, and impulsivity, impacting the daily function of some individuals. So people with ADHD may have trouble focusing on their attention on specific or single task, or sitting still for a long periods of time. Muna sila mga tao nga dili mahimutang or dili maka-concentrate sa isa ka bagay nga ilang gihimo. So the signs and symptoms for that is that the patient with ADHD may manifest difficulty sustaining focus, careless mistakes, forgetfulness, fidgeting, excessive talking, restlessness, interrupting others, impulsive decisions. The treatment is that we have the Ritalin and amphetamines to improve focus, and we need to have the cognitive behavioral therapy to organize organizational skills and impulse control. We have also the instill psychotherapy. So for nursing intervention, we need to build trust and rapport to patient, use clear instructions and visual aid to enhance focus to the patient, praise good behavior to encourage compliance, and then educate families on managing ADHD behaviors. We need to educate the family for them to know what their family who has ADHD is manifesting. So next would be, we're going to describe the autism spectrum syndromes in terms of its description, also type, signs and symptoms, treatment, and nursing intervention. So autism spectrum disorder is a neurodevelopmental disorder characterized by challenges in social interaction, communication, restricted or repetitive behaviors. People with autism spectrum disorder may also have different ways of learning, moving, or paying attention. There are types of autism spectrum disorder, which is the autistic disorder, Asperger's syndrome, and the pervasive developmental disorder. The autistic disorder is a severe symptoms across all domains. Asperger's syndrome is a milder symptoms primarily in social interaction na nakafocus. Ang pervasive developmental disorder is that the symptoms does not meet the full criteria of an autism. So the signs and symptoms is that the person may manifest difficulty understanding social issues, initiating or maintaining conversations, delayed or absent language development, difficulty with nonverbal cues, repetitive movement, and insistence or unsameness. So the treatment would be having the behavioral therapies, the ABA or the ABBA or the Applied Behavior Analysis to improve social skills, speech therapy to enhance communication skills of the patient, and also we have to adhere with the medications. For nursing intervention, we need to build trust and rapport to the patient, establish structured daily routines to reduce anxiety, provide sensory-friendly environments to manage sensory overload, and then we need to educate the families on ASD or the Autism Spectrum Syndrome management strategies. The next question would be, what is mental retardation? So mental retardation is an outdated term for what is now referred to as intellectual disability. So mental retardation nowadays is not used. Instead, it is replaced with the term intellectual disability or the ID. So intellectual disability is a neurodevelopmental disorder characterized by significant limitations in both intellectual functioning, which is the reasoning or problem solving, and adaptive behavior, which is the social skills and practical skills that become apparent during childhood or adolescence. The term mental retardation is considered stigmatizing, and that's why it has been replaced with ID or intellectual disability in medical and social contexts. So next would be, what are the different levels of mental retardation, and explain what are the levels of it. So first, we're going to know what is the mild, or the patient's IQ is under 50 to 69. So individuals can learn practical skills, achieve some independence, and often live independently with support. And then they may have difficulty with complex tasks, but can learn basic reading and math skills. The moderate, the IQ of the patient may range from 35 to 49, which that significant support is needed for daily tasks. Individuals may have limited speech and difficulty with social interaction. The severe, the IQ of the patient will have 20 to 34, which is they have the limited ability to communicate or care for oneself. Significant assistance is required. Profound is that their IQ is below 20, which has the minimal ability to care for oneself. Extensive support is needed for all aspects. For the treatment, we have for early intervention, we need to have special education and therapy to enhance adaptive skills. We have we need to focus on maximizing independency and quality of life, and educate the family on managing behaviors and providing care. Nursing intervention is that we need to tailor support to the individual's needs and abilities, teach strategies for promoting independence and managing behaviors, and then we need to facilitate social interaction and community involvement. So next is we're going to differentiate delirium from dementia. So what is delirium and what is dementia? So delirium is described as the acute reversible condition with altered consciousness and cognition. The causes of it are infections, medications, and withdrawal. The symptoms may be fluctuating, confusion, disorientation, and agitation. While dementia, on the other side, is a chronic, irreversible decline in cognitive function. The causes may be Alzheimer's disease or any vascular disease. The symptoms of a patient with dementia or the patient may manifest some symptoms of progressive memory loss or communication difficulties. So in conclusion, delirium and dementia differ in that sense of that delirium is acute and that chronic is the dementia, which is reversible and irreversible. So next question would be to define what is Alzheimer's disease. What are the signs and symptoms of Alzheimer's disease, the treatment, nursing interventions also. So Alzheimer's disease is a progressive neurological disorder causing irreversible cognitive decline, primarily affecting memory and thinking skills. So the signs and symptoms of Alzheimer's disease include forgetting recent events, learning new information, difficulty with word finding, or following conversations, depression, agitation, and anxiety. So for treatment, we have the cholinesterase inhibitors or the donepezil to slow cognitive decline, and for non-pharmacological intervention, we have the cognitive behavioral therapy and environmental modification. For our nursing intervention, we need to prevent falls and ensure a safety environment, engage in activities promoting mental stimulation, and educate family on managing behaviors, on providing care. So for question number 12, we need to describe the following eating disorders in terms of descriptions also, signs and symptoms, treatment, and nursing intervention. First is the pica, rumination disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder. First, let us define what is pica. Pica is an eating non-food items disorder. So example, someone with pica disorder eat some dirt, some chalk, some shoes, or anything that is non-ingested food. So for signs and symptoms, the patient may manifest the following: presence of non-food items in stool, and nutritional deficiencies. For treatment, we have the behavioral therapy and nutritional counseling. For nursing intervention, we need to monitor for nutritional deficiency and provide safe alternatives. Second would be the rumination disorder. So the rumination disorder is a repeated regurgitation of food. The signs and symptoms includes weight loss and dental erosions. For treatment, we have the behavioral therapy to manage regurgitation. And nursing intervention is we need to educate the patient on proper eating habits and monitor for complications. Third would be the anorexia nervosa. So what is anorexia nervosa? Anorexia nervosa is defined as a restrictive eating leading to severe weight loss. Like the patient is the thinking of the patient is that dili siya mukaon para dili siya motambo. So that can lead to severe weight loss. So signs and symptoms for that is that low body weight, fear of gaining weight. And then the treatment, nutritional therapy and psychotherapy. For nursing intervention, we need to educate the patient, and then on what is anorexia nervosa, on a proper on the importance of proper nutrition, monitor the weight of the patient, and provide emotional support. So next would be the bulimia nervosa. What is bulimia nervosa? So bulimia nervosa is a binge eating followed by purging. So example for that is that when someone eat too much, busog ang isa ka tao, and they pag kumanilag busog is they try to put their 2 fingers para makasukat sila, para maluwa rin nila tanan nila nga ikaon nga food. So signs and symptoms for that includes weight fluctuation and dental problems. For the treatment, we need to adhere cognitive behavioral therapy, medication for mood stabilization. As a nursing intervention includes education on healthy eating habits, monitor for electrolyte imbalances to monitor patients' progress. So next, it would be the binge eating disorder. So binge eating disorder is described as a frequent episode of excessive eating without purging. Excessive eating without purging. Like, para gaina sa bulimia nervosa is gait siya pero i-try niya, or iyang buhaton is i-try niya ana iyang mouth para makasukan niya, para iluwa niya tanan niya food. While the binge eating disorder is that frequent episode of excessive eating without purging. Sige ra siya kaon without realizing na nag-weight gain na siya. And then ana na siya ang signs and symptoms for that is that nanay guilt after eating those excessive foods. So treatment would be the cognitive behavioral therapy and medication for appetite control. Nursing intervention, we're going to build trust and rapport to the patient so that the patient can express themselves towards us, and then promote healthy eating habits and support emotional well-being. The last question would be the psychosexual disorders. The following psychosexual disorders is we need to describe the description or the definition of the disorder, signs and symptoms, treatment, and nursing intervention. First is the gender identity disorder. So gender identity disorder, referred to as gender dysphoria, is the condition involves a conflict between a person's physical or assigned gender and the gender they identify with. Signs and symptoms include persistent discomfort with one assigned sex, strong desire to live as the other gender. So treatment for that is that we need to have the psychotherapy to address emotional distress and support gender transition. Second is the hormone therapy to align physical appearance with gender identity. Third would be surgery for ating gender affirming surgeries. So for nursing intervention, we need to build again trust and rapport to patient, to so that the patient can fully express their thoughts or feelings to us, so that we can understand and we can know how to speak to the patient without any hurtful words to say to the patient. So first is we're going to provide a safe space for individuals to express their feelings, inform about individual available treatments and resources, and encourage understanding and acceptance within the family. So next would be the hypoactive sexual desire. So what is hypoactive sexual desire? So hypoactive sexual desire is a condition characterized by persistent or recurrently deficient or absence of sexual desire. Like dili sila maibog either babae or lalaki. They have the symptoms for that is they have low libido and lack of interest in sexual activities. So the treatment for that is that we need to adhere to psychotherapy, hormone therapy, and medications. For some antidepressants or testosterone may be used. So nursing intervention, build trust and rapport the patient, so that the patient can express their feelings comfortably to us, and then for us to understand the patient's condition. And then we need to have relationship counseling if issues related to partner dynamics. So next is the sexual aversion disorder. Sexual aversion disorder is defined as a condition where there is a persistent or recurrent aversion to and avoid a genital sexual contact with the partner. The signs and symptoms for that is avoidance of sexual activities due to fear and anxiety. Fear and anxiety ang patient ani this time. So treatment includes psychotherapy to address underlying fears and traumas, couple therapy to improve communication and intimacy kaya kasi may problema sa ila. That's why the patient is having fear and anxiety during when having sexual activities. So for the nursing intervention is gradual exposure. We need to encourage gradual exposure to sexual activity in a comfortable setting, and then emotional support, provide reassurance and support during the therapy. The next sexual disorder is dyspareunia. It is simply described as a painful sexual intercourse. So the signs and symptoms include pain during or sexual intercourse. So the treatment for that is that to identify underlying cause. It may be infection or vaginal dryness. We have physical therapy. We have also pelvic floor muscular tissues, and then lubrication friction during intercourse. So for the nursing intervention, we need to build trust and rapport to patients so that they can freely communicate to us and express their feelings while releasing all their feelings to us so that we can assess the patient thoroughly. Then educate the patient on pain relief strategies and teach alternative sexual positions or any techniques, or have the sexual counseling. So next would be the vaginismus. So vaginismus is described as an involuntary muscle spasms in the vaginal wall that interfere with sexual intercourse. The signs and symptoms include painful or impossible penetration during intercourse. So treatment includes physical therapy, vaginal dilators, and cognitive behavioral therapy to address anxiety related to intercourse. The nursing intervention includes establish trust and report the patient, educate patient on relaxation technique like deep breathing or progressive muscle relaxation, and then we need to encourage a comfortable setting for sexual activities. Next would be the premature ejaculation. So premature ejaculation is defined as ejaculation that always or nearly always occur prior to or within about 1 minute of vaginal penetration. The signs and symptoms includes inability to control ejaculation during intercourse, and treatment includes behavioral techniques, start, stop, method, or squeeze technique, medication, which is the SSRIs to delay ejaculation, and counseling. We need to enroll or encourage the patient to do counseling. Nursing intervention would include establish or build trust and rapport to patient, educate patient on behavioral techniques to manage ejaculation, and then encourage relaxation techniques to reduce anxiety. Next would be the female orgasmic dysfunction disorder. So female orgasmic dysfunction or disorder is defined as difficulty reaching orgasm or significantly reduced intensity of orgasmic sensations. Signs and symptoms include inability to achieve orgasm despite adequate stimulation. Treatment includes sex therapy, cognitive behavioral therapy, and some antidepressants. And then for nursing interventions, we need to educate the patient or the male, teach about the female anatomy and sexual response, sexual education, and then communication skills, open communication skills with partners, and we need to encourage also the patient to enroll in a counseling. Next would be the male orgasmic dysfunction, difficulty reaching orgasm or delayed ejaculation. Signs and symptoms include inability to ejaculate despite prolonged stimulation. Signs and treatment include sex therapy, medications to enhance orgasmic function, and counseling to address psychological factors. So for a nursing intervention, we need to teach or educate the patient on relaxation techniques, and then encourage patient to explore on sexual counseling, or for the patients to explore on sexual fantasies and desire. So next would be the erectile dysfunction. What is erectile dysfunction? Erectile dysfunction is the inability to maintain or achieve an erection sufficient for satisfactory sexual performance, difficulty achieving or maintaining an erection. So treatment includes phosphodiesterase inhibitors, the sildenafil, and then the vacuum devices to create an erection, and then counseling to address psychological factors. Nursing education would be establish trust and report the patient, teach patient about available treatment and devices, and then encourage open communication about sexual concerns. Next, psychosexual disorder would be sexual addiction. Sexual addiction is defined as a compulsive sexual behavior despite negative consequences. Signs and symptoms include engaging in excessive sexual activities is by harm to self or others, like di mahimutang ang patient may sa sexual partner. Treatment includes psychotherapy or the cognitive behavioral therapy, support group or similar to those substance abuse, and then medication to reduce sexual urges. And nursing interventions would be establish trust and report to patient so that the patient can express their feeling thoroughly, and then we need to address immediate risk or any consequences. So next would be the exhibitionism. So exhibitionism is a paraphilic disorder involving exposing one's genitals to an unsuspecting person. So signs and symptoms recurring urges to expose oneself in public, and then for the treatment we have the psychotherapy, behavioral therapy, and medication to reduce sexual urges. And then nursing intervention includes identify situation that triggers exhibitionistic behavior, and then educate on legal consequences and seek legal advice and if necessary. Usually nadyo mga tao na ani nga mag-expose sa ilahang private part in public places. So fetishism is described as a paraphilic disorder involving sexual arousal from non-living objects or specific body parts. So signs and symptoms exclude persistent sexual arousal for specific objects or body parts. Treatment for that is to explore underlying causes and manage arousal, behavioral therapy, and then medications. Nursing interventions include building established trust and rapport to patient, provide a non-judgmental support, provide a safe environment to describe or discuss sexual preferences, and then we have also the cognitive techniques to teach strategies to manage fetishistic thoughts. Protruism is a paraphilic disorder involving touching and rubbing against a non-consenting person. Signs and symptoms includes recurring urges to touch or rub against others in public places. So, treatment for that is psychotherapy, behavioral therapy to manage impulses, and then we have also the medication to reduce sexual urges. Nursing intervention would include identify triggers for fruitristic behavior, and then educate on legal sequences and seek legal advice if necessary. Pedophilia is a paraphilic disorder involving intense and recurrent sexual urges towards prepubescent children. Pedophilia sexual intercourse to those individuals who is under 18 years old below. Persistent arousal from children. Treatment is psychotherapy. We have also behavioral therapy and medication. We need to establish establish a report to patient, trust and report to patient, and then identify situation that triggers pedophilic thoughts, and then educate on legal consequences and seek legal advice if necessary. So next psychosexual disorder would be sexual masochism. It is described as a paraphilic disorder involving deriving sexual pressures from being humiliated, beaten, bound, or otherwise made to suffer. Signs and symptoms include persistent sexual arousal from pain or humiliation. Treatment includes psychotherapy, behavior therapy, and any medication to reduce sexual urges. Nursing intervention is that we need to provide a safe environment to discuss sexual preferences and ensure safe practices during consensual activities. Next would be the sexual sadism. Sexual sadism is defined as a paraphilic disorder involving deriving sexual pressures from inflicting pain or humiliation on others. The signs and symptoms include persistent sexual arousal from causing pain or humiliation. The treatment includes psychotherapy to address underlying psychological issues, behavioral therapy to manage impulses, and medication to reduce sexual urges. Nursing intervention would be establish trust and report to patient, identify situation that could trigger tendentic behaviors, and educate on legal consequences and seek legal advice if necessary. Next would be the transvestic fetishism. Transvestic fetishism is a paraphilic disorder involving sexual arousal from dressing in clothes typically worn by the opposite sex. Signs and symptoms persist includes persistent sexual arousal from cross-dressing, and treatment includes psychotherapy, behavioral therapy, and some medicine to reduce sexual urges. And then next is we have the nursing intervention. We need to provide a safe environment to discuss sexual preferences, and then cognitive techniques to patient. Next is the voyeurism. A paraphilic disorder involving deriving sexual pleasure from secretly watching other undress or engage in sexual activities like mo ni sila ang katong mga manilip o na mga manilip na tao nga nag-undress ang isa ka tao or na sexual activity. So signs and symptoms include persistent sexual arousal from watching others without consent. Their treatment includes psychotherapy, behavioral therapy, and some medication. We need to educate the patient, or we need to have or establish trust and rapport so that the patient can open to us freely, and then identify triggers for voyeuristic behaviors. Zoophilia. Zoophilia is a paraphilic disorder involving sexual arousal from animals. Sexual sense and symptoms includes persistent sexual arousal from animals. We need to have, for treatment, we have psychotherapy, behavioral therapy, and medication, and then assess the patient, and then interview the patient thoroughly, build trust and rapport, assess the risk, identify situation that can trigger zoophilic behaviors, and then educate on legal consequences and the legal advice if necessary. Next would be the necrophilia. Necrophilia is a paraphilic disorder involving sexual arousal from corpses. Persistent sexual arousal from corpses. The treatment includes psychotherapy, behavioral therapy, and medication. Nursing intervention is that we need to assess the patient for risk, triggers neurophilic behaviors, and then educate on legal consequences. Coprophilia. So next would be the coprophilia. Coprophilia is a paraphilic disorder involving sexual arousal from feces. Persistent sexual arousal from feces. The treatment includes psychotherapy, behavioral therapy, and some medication to reduce sexual desire. And then nursing intervention is we need to have or provide non-judgmental support, provide a safe environment to discuss sexual preferences, teach strategies to manage fetishistic thoughts. Next would be the urophilia. Urophilia is a paraphilic disorder involving sexual arousal from urine. Persistent sexual arousal from urine ang signs and symptoms niya. Treatment includes psychotherapy, behavioral therapy, and medication. Provide non-judgmental support or interview the patient. First, we need to establish trust and rapport the patient so that they can share freely. And the next would be the partialism. A paraphilic disorder involving sexual arousal from specific body parts. Persistent sexual arousal from specific body parts, like ilang urgency kay nasa imong specific body parts sa katao. Treatment includes psychotherapy to explore underlying causes and manage arousal, behavioral therapy to redirect sexual interest, and then medication to reduce sexual urgencies. And then nursing intervention, we need to build trust and rapport the patient, provide safe environment to discuss sexual preferences, and teach strategies to manage fetishistic thoughts. Lastly, we have the telephone scatologia. Telephone scatologia is defined as a paraphilic disorder involving making obscene phone calls for sexual arousal. Persistent signs and symptoms include persistent sexual arousal from making obscene calls. Treatments include psychotherapy, behavioral therapy, and medication. We have also nursing intervention. We have identified triggers for psychological behavior and educate on legal consequences and seek legal advice if necessary. So that would be all on our self-recorded or self-directed learning activity on psychiatric nursing.